Hi, everyone, and welcome to today's session, the Value Chains Linking Rural Food Access. Today, we will have a wonderful presentation. Next slide, please. And a few housekeeping things. This session is being recorded. All recordings will be available after the event. Language translation is available. I will drop the phone number to call to get the translation in the chat. And the Q&A will be at the end of this session. Please enter all questions directly into the Q&A box and feel free to chat in the chat box. Right, to get us started today, next slide. We have Nancy Hunt and Colton Oxendine. I'll turn it over to y'all to give you a brief introduction and get started.
Hello, everyone. Nancy and Colton are joining us, as they've just said. Nancy is with UNC's Health Southeastern Grant Facilitator, and Colton is the Housing Authority of City of Lumberton. And I believe they're going to take it away. Next slide, please.
Hi, I'm Nancy Hunt. I work with UNC Health Southeastern, which is located in rural southeastern North Carolina. We are a small hospital facility that is managed by, if anybody's familiar with the UNC Tar Heels, the health system there. Colton and I are partners in a project we're calling Robinson Fresh Moves. Next slide, please. So a little history about where we're from. The red that you see, little red dot on North Carolina, that's where Robinson County is located. We are considered one of the 10% of U.S. counties that are majority minority. We are triracial, so we're unique in that way, with over 70% of our population considered minority. That's basically made up of Native Americans, African Americans, and Caucasian. We're home to the largest non-federally recognized Native American tribe east of the Mississippi. That's the Lumbee tribe, which has an enrollment of around 50,000 people. We're the largest county in North Carolina, covering 949 square miles, and also considered the poorest county in North Carolina. Our health disparities based on our Native American population and African American population have been very well documented through the hospital system for years. We have high incidences of diabetes, hypertension, COPD, all the chronic diseases, which from my investigation of a lot of Native American tribes seems to be pretty prevalent. Some of the things that I've seen on these videos that I've been watching, Save the Children, for the past 2 days have indicated a lot of that as well. Next slide, please. Oh, one back, yes. So this is the Lumber River. Lumber River runs through the heart of our community, and that's kind of how our communities got started, was everyone was centered around this Lumber River. Presently, our community has around 120,000 residents. 20% of these are defined as persistently poor, meaning that over a 30-year period, these groups of people have remained in poverty states. 34% of our children are designated as food insecure. We suffer from adult obesity at a rate of 44%. We still have adults who are smoking at a rate of 28%. Our diabetes prevalence, 14%. And the thing that I find most interesting, again, working for a hospital situation, because I'm always focused on chronic diseases and how can we turn that around and make the hospital more efficient. If you have a zip code that is affiliated with Robinson County, North Carolina, your life expectancy is 8.5 years shorter than those communities in North Carolina who have higher life expectancies, just because you live in Robinson County. We are habitually ranked last in the state. There's 100 counties in North Carolina, so we're ranked 100 every year on the Robert Wood Johnson's annual health report that comes out. So again, as an employee of a healthcare system, my job in community health services is how do I take all this information and work around it to try to make our community a healthier place to live. Next slide, please. So I don't know how many of you are familiar with community health needs assessments, but in North Carolina, our law requires that every 3 years, the hospital and the public health department come together and do a community health needs assessment. And we do that by developing surveys that we send out to the public to help ascertain the public's perception on what the problems in our community are. And then we have to develop our focus and our priorities going forward for the next 3 years. On this slide, I've got our 2020 health needs assessment. We've just recently completed our 2023, but it's not yet been released to the public. So we're going with 2020 here. But you see that the two things that stood out in our surveys we sent out was obesity and substance misuse and abuse. So we took these two, and under obesity, we decided to concentrate on nutrition and physical activity. We, again, being a rural county, we have lack of access issues to get to healthy food opportunities, and we have a lack of safe places for people to exercise. So I begin to focus on what you see on the bottom, social determinants. How does social determinants play into all of this? So next slide, please. So this is a photograph of our Native American tribe, the Lumbee, most recent powwow that we just had. Some of the data that I collected in our county, that 949 square mile county, we only have 29 grocery stores. We have 98 convenience stores, and I think that's a conservative count. 68 fast food restaurants. We have what is considered essentially no public transportation. We do have this program called Southeastern Area Transit that works by appointment only. And the transportation system that we have can pretty much guarantee you, if you've got a doctor's appointment, that they can get you to your doctor. But if you need to go to the grocery store or the pharmacy or anywhere else, that's just not available. 4,752 households we have currently listed as having no vehicle at all. So again, we've got grocery stores really spread out, basically in certain townships. If you live out in the country, you may be miles and miles from a grocery store. But one of the things that's occurring in our community is we do have a lot of dollar stores popping up. And those are being built in our marginalized communities. Problem is, they don't offer much of a selection when it comes to fresh and healthy food items. So again, hospital researcher, my focus, chronic disease. What do I do about this? How do I address this issue when I know that people can't really get to healthy food, but we want them to have healthy food, but they don't have a car and we don't have anything close to them? Next slide, please. So one of the things we started, we actually have a group called Healthy Robinson. This is a collaborative effort of about 40 different people from 20 different agencies that have come together to brainstorm how to make our community healthier. So one of the things we started doing is we developed faith-based partners, and we are doing mobile community resource hubs. These are some pictures of one of our hubs. We'll put out a flyer. It'll be a food distribution. We usually try to focus on healthy foods. You see the strawberries in the bottom. We have a lot of agricultural opportunities in our community. A lot of farmers, local farmers growing fresh fruits and vegetables and raising their own grass-fed cattle. So we have the opportunity to provide for people. Unfortunately, a lot of this produce and beef and whatnot is being transported out of our county rather than being kept here. So with our Healthier Together initiative, we have these hubs where people can come out and they receive information on things that are available for them in our community. You know, where can they find food pantries? Who can they get help from if they're food insecure? And then by coming out, we usually give them a 40-pound box with meat and vegetables, fresh seasonal vegetables. And it's worked really well. But again, working with the hospital, I look at this, what's the problem? Well, you've got to get to the church where the hub is. If you don't have a car to get there, you still can't get to the food. You know, we had no service that would help us take the food to the people. So, next slide, please. And I'm going to turn this over to Colton because he's going to tell you how we attack this problem.
Hello, everyone. I am Colton Oxendale. I am the Ross Coordinator for Lumberton Housing Authority, and I'm also the Resident Service Director. So I am going to tell you a little bit about what the Ross Coordinator is. The Ross Coordinator is the Resident Opportunity and Self-Sufficiency. Well, what does that mean? It's a service coordinator who will assess the needs of the residents of public housing and coordinate available resources in the community to help those. So basically, long story short, I help get them off of welfare, off of government funding and any funding from the government. I help get them off of it, help find them resources, anything that they need, such as clothing, food, which is a huge issue. Food, I never understood that until I started this position in this county. I never understood that until I met Kathy and we had a wonderful conversation, but I will save that and tell you a little bit about Southern Carolina Housing. So Southern Carolina Housing is the nonprofit arm of the Lumberton Housing Authority. It was created to endow scholarships to the residents of the Housing Authority of the City of Lumberton, to our local Robertson Community College to help fund higher education. The reason we want to fund higher education is to get them out of public housing and show them their other options. We want to get them out of public housing, show them that they do have other options, that you can own a home, that you don't have to live under government assistance, and that you can go out and be on your own and be successful. We assess the needs within our community: food insecurity, drug abuse programs, partnering, parenting skills, mentoring programs. All of that falls under my program, and I make sure to implement that. Using the nonprofit arm of the Housing Authority to create new programs outside of the work-related events. So we do things outside of work to make sure that our community gets what it needs and let them know that they are loved and that we are doing everything that we can for them. We help provide ways to put it in food insecurity. Every holiday comes around, we partner with our local Mountaineer, which is the fresh chicken. They actually come by and give us produce from, well, fresh produce boxes. And I pass those out for Thanksgiving, Christmas. Christmas last year, we gave out 3,000 boxes worth of food, which included each box fed a family of 4. So that was 3,000 boxes that went around all of Robeson County, not only Robeson County, but surrounding counties in North Carolina. Next slide, please. So how did I get this idea? Well, my boss, we went to Kentucky, and we went to Kentucky Housing Authority, and it's just wonderful. Everything they do, everything with resident services, they have everything that you can imagine. The one thing that stuck out to me was one thing that really, really stuck out. They had a mobile grocery store. When I stepped on it and stepped off of it, I couldn't do nothing but take pictures and just imagine, what if we had this in our county? What impact could this make? What could I do with this to make a dent in food insecurity? How many children could I help? How many families could we change within our county? So the conversation started at a Kiwanis, which is for young professionals or older professionals. And basically you just sit down and you talk and you partnership. And I met the wonderful Miss Kathy Hunt. And we sat down and we collaborated. And I said, you know what? I showed her my idea of what I wanted to create. And she was wonderful enough to sat down, found a grant, wrote it, and we got it for $100,000 thanks to Save the Children. So a huge shout out to Miss Kathy for that, because I can't give her enough kudos for that. But now we have the funding thanks to Save the Children to actually provide that. So let's talk a little bit about the bus. Understanding the transportation plays a critical role. One thing with us is that all of our sites, we are one of the largest housing authorities in North Carolina. One of the biggest struggles that I see is that I see my residents carrying 2 arm loads just like this, almost 2 miles home from the grocery store. Imagine you are 65 years old and you are walking home 2 miles, you got 2 miles to go. Every 3 minutes, you're having to stop, drop your bags, take a break. So imagine how long that takes you to get home. One lady said it took her 2 hours just to get home, and she did it in the rain. And she does this once a month because that's as much as her heart could take. She couldn't apply for the siege transportation, which Miss Kathy spoke on, because she couldn't afford it. She couldn't afford the $2 there and the $2 back. And plus they don't provide that because it's not a doctor's appointment. So we have a huge issue with transportation in our area. So the whole idea of this is take this mobile grocery store, fresh produce, fresh food, fresh meat, fresh everything. Obviously we can't have fresh everything technically. We know we're going to have a bag of chips somewhere. We're going to have a can of soda somewhere, because not everybody just eats healthy. I know I eat healthy all the time, but I have to sneak a little bit in somewhere. So of course, on this bus, we're going to have everything that they need, but the goal is to put a dent into the struggle that they go through to get food. That is our overall goal. We want to stop poverty. We want to put a dent into food insecurity. And one of our largest food banks only allow you to go maybe once or twice a month. That's a huge issue. Food stamps only come once a month. Once you burn out your food stamps, that's pretty much it. So we want to be able to have a bus that comes through weekly, throughout the week consistently. That way they're not throwing the money away once a month. All the fresh produce, as we know, produce goes out usually within 1 week once you buy it. So it's not fresh after usually the first week. So we want to be able to provide that within, throughout the month. But we want to cut down the time and money spent on traveling to the grocery store, circulate revenue within the local community. We want to partner with local farmers, the local grocery stores. We want to sit there and we want to make not necessarily a profit, but we want to make sure that we're making everybody happy. We want to show everyone that this is making a difference, that we're strengthening the economy as we do this, and we're putting a dent into everything that's pretty much going on. We're making that impact that it needs to make. And again, we don't want to reinvent the wheel. I seen the idea, I liked it. Me and Kathy took it, we ran with it, and Save the Children helped us along the way. And you can go to the next slide. And again, we were awarded the $100,000 grant. Southern Carolina receives a grant from Save the Children. One of almost 100 applications, only 5 were picked to receive funding. The idea to create a mobile grocery store to go throughout the county, building a bridge to migrate food insecurity. Next slide. And as you see, of course, me being extra as usual, you see me posing in front of the Wild Bus. Well, guess how much this bus actually cost? It only costed Colton, well, the housing authority in Southern Carolina, $1. I got a whole bus for $1. How did I do that? I approached the CEO of the actual hospital here, which is a big deal, thanks to Kathy's bright idea. And I approached him with the idea because they weren't really using the bus. And I approached him with the idea, the thought, who it would be helping. And he immediately replied and said, let's do it. Let's do the exchange. So I got the bus for $1. And now we are in the retrofitting stage. And now me and Kathy have a phone call literally after this about the retrofitting. So we got caught up in a little bit of the legal work from the hospital, but now we are retrofitting this whole thing to turn it into literally what we want it to be, our dreams. Next slide.
Okay, so these are our goals for this project. And this is pretty much what we said in the grant. We want a sustainable, healthy food retail location in low income, low access areas. It's going to come to them. No more of them walking in the rain to go to a dollar store to buy their food. We want to sell healthy foods. That's, once again, that's the hospital chronic disease person in me. I have since had to, I think, in many conversations, people had to adjust my thinking a little bit on that. Yes, we want it to be healthy, but I also realize that it's important not just to feed someone's stomach, but also feed their soul. And so I have to understand with our minority populations, some of those culturally appropriate foods and the way they prepare them might not always be healthy, but that's what they need to feel like, that they're, keep their dignity intact and everything as far as our community. We want to use our local farmers to boost our economy, keep that money in our community. And the hospital specifically in Healthy Robinson's goal will be to educate customers on healthy eating and the benefits of buying local. Next slide. So we went out into the community and we wanted to use human-centered design around how we put this bus together. So we had community cafes based on the World Cafe model. Healthy Robinson conducted these. And we provided folks with a meal and $25 gift card to go to their local grocery store and a bag of other goodies that they could use so that they would be willing to give us their input on what they want this bus to look like, how they want it to operate. Next slide. Our findings. Of course, they want this bus to be bright, colorful, clean, and when it's refurbished, it is going to be. Colton and I have even talked about having a jingle design, just like the ice cream truck, when you hear the ice cream truck coming. So the Fresh Moves bus will have a jingle. They said they need the schedule to be a varying schedule. Some of the residents work, so they can't come to our mobile grocery store in the morning. It should come twice a week, mornings and afternoons, or Saturdays. On the inventory, and I think this was the thing that I was most taken aback from, they don't just want food. They want cleaning supplies, paper products, and having a car. I'd never thought about this, but just what Colton was saying, if they have to walk a mile and buy laundry detergent and Clorox and those types of items and then carry them back home, the weight of that, it never occurred to me. Happily, from my standpoint, they really placed an emphasis on wanting fresh, local, seasonal produce. So that's going, again, to allow us to really connect with some of our local farmers and make them partners. When it came to payment, they want to be able to take all types of payments. So that's going to be Colton's job to get in there and figure out how they will be able to take SNAP and EBT. Again, in our community, there are a lot of food giveaways, but you have people that, they want to have dignity, just like every other person. And they want to be able to go to a store and select the foods they want, not somebody just giving them what they need to, get rid of. And so they want to be able to buy their food, but they also said we should have sales and give out coupons. And they were very adamant about employees needing to be friendly, helpful, knowledgeable about what's on the bus, and be able to help senior citizens and handicapped shop because they might have difficulty getting on the bus. Next slide, please. These are just a few of our partners. So we've got the public schools involved. They were involved in the design of the exterior and interior of the bus, with the thought process being that children who were in the career and technical ed classes that did the design, when they see that bus driving down the road, they can say, look, Mama, I helped design that bus, and that bus is helping to feed some of my classmates. Food Line, that's a local grocery store. You know, they're working with us on getting us the products wholesale. Our county government and city government are working with us on putting this bus into their budgets going forward in 2024. Lumbee River Electric Membership Corporation, which is one of our big providers of electricity here in Robeson County, they've added us to their budget starting in 2024. One of their pillars that they operate by is service to community. Well, so now they're serving the community to help them get healthy food or help them be fed. Not always healthy, but help them be fed. So our hope is that by providing access, and that's what it's all about, making access better for people, that's going to help our children, because now mothers and fathers can fix home cooked meals, can better take care of their children and make sure that everyone in the family is fed. And again, it helps us, our folks here, live in dignity, just like the rest of our community that has transportation. So they don't feel singled out anymore, and that it's not a situation where they're asking for somebody to hand out for them. Anything else, Colton? Because I think that's our last slide before our slides with our contact information.
I think that is it. Overall, we just want to put a dent in poverty, and we want to make it as easy as we can for them. And there is a huge struggle where we stay, and me and Kathy are on the move, and we're trying to do everything that we can for our community. And if you have any concerns, we're here.
And we thank you for allowing us to present on our project.
Thank you, Kathy and Colton. That was very inspiring. I always appreciate when I see other people doing similar work and succeeding, because it gives us like that charge of like, oh, like we're doing it. Like it literally takes more than a village to do this stuff. And it's so great when I see others out there. Like, I don't know, I feel good listening to that. So thank you all very much. We're going to transition over to our team a little bit here in the presentation that we have. My name is Shane Benton. I am the Food Access Program Manager with Rural Action's Sustainable Agriculture Program. And joining me will be Tom Redfern, who is the Director of the program, Sustainable Agriculture and Forestry. And we're going to talk about some of the work we do. And in our region, we currently operate in the Appalachian counties of Southeast Ohio, but our partnerships and connections branch out further. As you can see on the current slide, a lot of the economic challenges of Appalachia, and honestly at large rural America, overlap directly with some of the poverty rates and opportunities. As I said, we're in that Southeast Ohio Appalachian area, but the same issues we face are ubiquitous throughout the region. We'll take the next slide, please. And kind of matching up with those first two slides there, this next slide shows food apartheid in Appalachia. A lot of the regions that are economically distressed also have issues with food access. In the state of Ohio, where we're located, 1 in 5 Ohioans have a life expectancy of 65 years, which is well below the national average. And part of that is health issues, which can be directly related to food access, quality, healthy food. Much in the vein of what our previous presenters mentioned, we have lots of Dollar Generals and convenience stores, but the access to really fresh local food is a little more challenging. And we are very much aligned with the ethos of food is medicine. And so healthy food can generate healthy outcomes. Next slide, please. One of the first steps in trying to be an advocate for healthy food in the region, and this is work that no one can do alone. Like none of us, the problem and the scope is so big that no one person or one organization can address this by themselves. So it takes partnerships and it takes these value chains of like-minded people to be successful. And one of the first things you want to do in a region is to identify your champions, identify the stakeholders and the role players who have similar values and are interested in similar outcomes, so that together we can find the ways and the means to reach the people we need to reach and to accomplish the things we want to accomplish. The next slide, please. And again, at Rural Action, we have lots of partners. This is only a cross section of some of them. Some that we work with the most, whether it be through funding or physical labor or just like the connections that help us out. Most recently, we were approached by one of our partners in West Virginia. Someone had reached out to them. They were trying to find a home for 28,000 bushels of apples, which is mind-boggling. I think I estimated it was like 1.2 million apples or something. That's a lot for any one person. That's a lot for me or my organization or anyone just to manage. So once we had that information, it allowed us to reach out to some of our other partners in the network to see like what is their capacity, what is their need. And it is still a work in progress, but the ball, if you will, is moving forward because of the relationships we have. Like the opportunity presented itself because of the relationships we have and because of, in essence, the links in this chain that we're forming of demand and need. Next slide, please. And it is these networks and these partners that make it successful, whether it's where do we acquire the food, who are the farmers we're working with, what are the outlets for this food, like who's in need, whether it's schools or hospitals, food pantries. It's one thing for the farmer to grow it, but then it needs to go a place. And by connecting these various groups on their shared missions, it allows us to ideally create a sustainable network that, we come in to communities and talk to them about their needs and what we can do to be an asset. And, if we work together and get funding, as a lot of you know, funding has a start date and an end date usually. And yes, you can reapply, etc. But the ideal is to get these systems in place that are sustainable so that, we're coming in helping to facilitate things, but ideally we step back and then these communities with the tools and the resources they've been giving can continue this good work. Next slide, please. And then
So here,
go ahead, please.
I'll jump in a little bit, Shane.
Yes.
So just to dial back a little bit. So Rural Action began in the late 90s. Like you saw from the slides that Shane was showing. We work in a region of endemic poverty that's basically file has had cycles of boom and bust. Faced with the coal industry, where all the wealth would leave the region and leave behind the aftermath. So Rural Action works with something called asset-based community development. What are the assets that we have to make our own area better? So the best way to do that is working in networks. So regional networks make structure, make linkages. Working together to accomplish what we can't do on our own, making sure that all the stakeholders are engaged and welcome diversity, makes the collaborators wise stewards. Peer learning, we share our results. Lift a shared voice, because we're thinking of a just transition. How can everybody share in the new economy? And it works with nature, make healthy and resilient ecosystems. Next slide. So we think you need 3 key things to make a local food system. You need processing, places to value add the products that you have before they leave your region. Plus, we need aggregation, places where multiple small producers can bring their food together. And then the key thing being, as we heard, distribution, processing, aggregation, distribution, make a local food system. So for food access, we work with these partners. So just as an example, we work with an organization, Community Food Initiatives, which operates a thing called the Donation Station. So basically, they set up at farmers market, and they can take donations of fresh local food, and then they share that out to 45 organizations, which include like free meal programs, food pantries, food banks, things like this. But the key thing is they're functioning in that local food system at the market, the local food. So food hubs means that aggregation point. and then farm to school in rural America, biggest employers, biggest consumers of food are often the school districts. So we'll speed it up. Farmers market and Country Fresh Stops is a program that we do where we take local food to gas stations, to corner stores, places like that, to move the food access to like food apartheid communities. Next slide. It's all you, Shane. Move this slide, please. There you go.
So as we reiterated, collaboration is key. We work with partners in the Appalachian Accessible Food Network, which we are part of. It's Rural Action, Community Food Initiatives, who do the mobile distributions, and then AceNet, which is a processing facility, a shared use kitchen, if you will, where ourselves, independent businesses, et cetera, can go there, process food to value add to their product. Also, we have partners with the Central Appalachian Network that kind of help us expand beyond our borders of Southeast Ohio. And it's, us working together, whether it's on new projects or like the idea phase, the implementing, checking back with what has been successful and what is not. That allows us to continue our work. Next slide, please. And as we were saying, it's these value chains that really make it all work. We all have different roles and different stages of this. I know, like specifically, I'm going to be commenting on our produce prescription program. That, the Osteopathic Heritage Foundation helps with that. The National Institute of Health helps fund that as well. No Kid Hungry, like you get resources from various places. But as Tom was saying, you get the input from the farmers and like production's happening. You've got to process and distribute and aggregate that to get it to market, to get it to the consumer, so that we create these chains to help access occur in the first place. Next slide,
And
please.
the thing is, real quick, it's beyond a supply chain because you're valuing the existence of the other components and your partners. Like you're not, the bottom line is not the bottom line isn't the only important thing because you're recognizing the importance of the existence of the other components. Next slide.
Well said. And again, this is one more slide, again, just kind of reiterating the existence of the value chain and how it's all connected, whether it's the farmers getting their supplies in so that they can sustain the local farm economy, getting the food to the, the food banks, the pantries, the farm stands, the school feeding programs, school garden programs. That all works because we see value in the chain. The partners, the stakeholders, if you will, the champions see value in it. And all along the way, everyone benefits from it. No one is sacrificing in a sense to make this happen. And it's all something we all believe in and all have the same shared values to keep it going and thriving. Next slide, please. And, the value chains we're making, it's all about food access and increasing local food access and local food economies. We do that with a few of these partnerships listed here. We do farm to school programs. The big one we're talking about today is produce prescriptions. We in our region are working with the Hopewell Health System in Southeast Ohio and Copeland and Western West Virginia. Currently, or at our peak, I would say we are servicing about 200 clients a week with fresh, locally grown bags of produce. And much to what Kathy and Colton were saying, you're not just feeding people's bellies, you're feeding their hearts and souls, giving them high quality, fresh out of the fields produce. It shows that people care, that they are worth having the best top quality produce, and not just like, oh, this is about to go bad, take this. It's about creating these systems where everyone along the way matters. And with the produce prescriptions in general, like we're developing more of a partnership with actual doctors doing case studies. So we're about to embark on a multi-year study of measuring the physical health outcomes of having fresher, better food as part of your regular diet. And part of that produce prescription program, at the beginning of the season, we provide them with Healthy Pantry Basic Kits, which is basically a kit that has things like colanders and paring knives and can openers and cutting boards and a few basic seasonings for their kitchen, olive oil, peelers, a healthy home consumer guide, which was a little book we made with some of our partners that kind of informs people on some of the healthy aspects of the various produce they might receive. We provide recipes throughout the year for ways to make things that they might not encounter as often. And basically it's the entirety of the value we're giving, so that they not only have access to food, but have the knowledge to prepare it, to preserve it and put it back. So when they have extras, it lasts them a lot longer. We work with a lot of farmers and get fresh food during the growing seasons, but that is, late April to end of October, and then it kind of dwindles. But we want people to have food throughout the year. So when it's in abundance, you can get it, and we're giving them the knowledge to put some of that back and preserve it so they have it during some of the winter months. But we're ideally, as the study progresses, we are strong believers that food is medicine, and in the next year or so, we'll have more quantifiable data to show, hey, like there are healthy outcomes when people have access to healthy, nutritious food. And on the end of the insurance companies, what we hope to see is that they realize that they can spend less money treating things and more money preventing them, and getting a better return on investment by getting that healthy food there into people's bellies, in their kitchens, on their tables, as opposed to, oh, this person has some adversities we need to treat, when, we can be preventative with healthy food. Next slide, please.
So speaking about aggregation, here's what that means. You're looking at a picture from the Chester Hill Produce Auction, which is a partnership between Rural Action and a small Amish community and other farmers in our region. The small producers bring that food there, and then people from all over the region, they come here, and it becomes the food that we can both process and distribute. So you're making like a food hub, which means a destination for rural area, which drives the economy. Plus it feeds the distribution. Next slide. Here we're talking about the impact of that, all the farmers it served, the money it's brought in, making that demand. Next slide. And
I'm gonna get this one kind of quick, you guys, because I know we are getting crunched on time. But again, some of our partners, the Appalachian Staple Food Collective, our collaborative, I'm sorry, you know, we have programs called Neighbor Loaves where people can, at the like local bakeries, like provide fresh baked bread. You can, you know, kind of pay it forward and buy food for like people who can't maybe afford it as much, like high quality local baked goods. And it's doing things in a way that is smart and sustainable to kind of get some products in the region that like maybe people overlook, like chestnuts, for example, and how do we incorporate those a little more? Next slide, please. Again, Tom was saying like aggregation leads to distribution. And the distribution is where like, you know, the food hits the pavement, if you will, and how to get it out. And that takes a network. No one organization can get all the spots. So working with partners, acquire the food, get the food out. This is a picture of the Southeast Ohio Food Bank in Logan that we work with. And they're great partners as well. Next slide as I wrap this up. And again, farm to institution, Tom was saying what some of the greatest employers in the region are schools, their healthcare providers, and getting more fresh local food connected with them provides more outlets for the farmers, gets our people and our kids fresh local food access. So it's really important to identify some of those organizations, reach out to them and talk about how we can get, whether it's like, hey, your salad bar at the school always has carrots. We would love to get those carrots for you. Finding that niche you can get into that allows more food to get out. Next slide, and I think we're about got it. And then, yeah, finally, it's what are we doing this for? It's about nourishing our greatest assets. Like the children is where it starts. Everyone needs good food, but kids need full bellies so they can get full brains and learn and continue the good work. And some of the most rewarding stuff I do is working directly with kids. And it's like, you know, they get an apple and they're like, oh, this is delicious. Or, you know, I've never had one this good or this fresh. So that about concludes it for us. I'll definitely leave it open for questions. I want to have time for that. Thank you all for having us.
Thank you.
You mean like grocery stores, supermarkets?
I'll leave that to you. It could be anything that has helped move your work forward.
I guess to me, I would say our local government here has been our greatest partnerships. They have been willing to put us in their local budgets for the upcoming years. So I'm thinking that is the best partnerships because they're willing to put us in the budget for the upcoming years to help us with the upkeep and keep the bus rolling and help us with, again, the upkeep, keep it funding. So I think that them them putting us on their budget is, you know, that's a huge thing for a agency to put us on their budget. That's a huge step. So I think that those partnerships are, you know, that's one in a million. Not everybody does that.
I also feel like with our Healthy Robinson Coalition, all of our partner members in that have just unilaterally jumped on the bandwagon for this project. Whereas they might not be able to contribute to it financially, they are contributing in other ways, helping with our community cafes, helping make their, you know, for example, the Partnership for Children is a member of our coalition. So they're just making other people aware of it. They're also helping us with the process of these elected officials. You know, I might not know somebody, but somebody on the coalition knows someone and they put a plug in for us. So it's really been a community effort with a lot of different organizations volunteering to help with this project.
Right, to build on that with rural action, I think it's really hard to pick a favorite partner. My personal one would be the producers that we work with, the farmers, but also like the key partnership that we have with the Appalachian Accessible Food Network, as we call it. With bringing together ACENET, which is the Appalachian Center for Economic Networks, which has the processing, refrigeration facilities, the partnership with community food initiatives, which is teaching
And
healthy
And really,
eating.
any partnership really is
Yes,
worth it. Any partnership will take it.
exactly.
So,
The thing is having an open door to partnerships,
yes.
I think is
So-
the key.
So I think that any partnership, long as they're willing to sit there and say, hey, we're willing to help to put in, if it's nothing but 2% of what they can do, if they're willing to give you 2% of their time, that lets you know that they do care and that they do believe in your project, and that they are willing to, give you that effort. So even if it's 2% on down the line, it could turn into 50%, 75%. If you just keep being persistent and you keep succeeding and you just keep full throttle, it'll continue to grow. That is something that I have learned.
Right, to add on to that, I think a big thing is to keep listening.
Yes.
I think also I'd like to say like partners are really important, not just because it increases capacity, but there's days or weeks where you're tired. Like, you've been busting butt, getting a lot out, and you're like, oh man, I don't know if I have anything left in the tank. And then, sitting on a summit like this and hearing other people's good work they're doing, and it like recharges you. And you're like, oh man, like I'm not doing this alone. I don't got to do it all alone. Like we've got partners, we've got people doing good work, and just getting those recharges by knowing that it's a team, like it's a team within a team within a team, like all getting it done. So yeah, I would not discount any partners. Yes, organizations with funding are always great because it takes money to do things, but it also takes people on the ground. It takes those relationships with, the food coming from somewhere. It doesn't come out of the air. You got to have those relationships with farmers and producers. You got to have an outlet for it. Like you can grow all the tomatoes you want, but if you don't have nowhere to take them to, like, what are you doing? So yeah, all partnerships I feel like are of value in their own pockets, depending on what they do.
Wonderful. I think that about wraps us up.
I'm very thankful for the opportunity and the time. I'm thankful for hearing other people's stories and the good work they're doing. It's been a long few days and I feel a little bit recharged. So thank you all.
Thank you guys.
Thank you all.
Thank you.